M1K2S3. That's the postal code I'm standing in the middle of right now, in the heart of Scarborough, one of the areas considered to be a COVID-19 hotspot in Toronto. Now that the province and the city have determined that location is key for vaccine rollout, clinics like this one have actually been planned long before now.
Very convenient, very convenient. It was easy for me to get here. Luckily, I got a girlfriend who drove me here, so it didn't take us no time at all. So it was a good experience.
Known as the Hub, it couldn't be more appropriate as one of the spots for those in this neighborhood to get their vaccine. It's home to the Scarborough Centre for Healthy Communities, located at Eglinton and Brimley. They've teamed up with the Scarborough Health Network to make sure everyone in the area has better access once they have the opportunity to register.
These community-run clinics speak to a huge need, a factor of trust and relationships that we have with the communities that are really important. We've had people waiting for us to open so that they can come and get their vaccine here.
The province released its list of targeted postal codes for vaccine rollout in the GTA on Wednesday. It's a shift from previous plans concentrated on ages and frontline workers. Healthcare organizations throughout the region, however, had already planned to get into individual communities and reach out in a variety of ways.
Without tooting our horn too much, I mean, this has been planned. This is months, and if you happen to see the plan that we produced maybe 2 months ago, this was all outlined. We had 2 mass vaccination centers, we had 3 centers in the community, and a number of pop-ups.
The Hub location opened this week, starting with 350 appointments a day, with plans to ramp up to 500 7 days a week. Much like other clinics, those with appointments make their way inside to be screened, registered, and get their shot before waiting in an observation area for 15 minutes while booking time for a second dose.
Our community partners, in terms of helping to get the message out, helping to ensure that their clients, their citizens are able to access those services, and doing a lot of that communication that is also really important.
Kevin Nagel got word from a community organization that this was opening up 5 minutes from his house, and he jumped at the chance.
I guess they're sending out emails, and they've got flyers that are going out, so I got the flyer, and I called the same day I got the next day, and I was in today, so it was good.
And without waiting for government priorities to shift, those 50 and older at this point already have a place to go close to home.
Yes, and as long as you got the places for you easy to get to, I think more people will get it done. Because that's the main thing, that we all get it done.
The city has now said that more mobile and pop-up clinics will be made available in neighborhoods like this one for those age 18 and older. Details on where they will be exactly and how they will be rolled out aren't yet available.